Hello, and thank you for joining this Onc Live TV Peer Exchange. This program will feature expert panel discussions focused on metastatic breast cancer. Our panelists will comment on genetic testing, explore therapy for treating metastatic breast cancer in a variety of settings, and share insights about promising therapies that are in development. I'm Dr. Adam Brufsky, Professor of Medicine at the University of Pittsburgh and Associate Director of the Division of Hematology Oncology there. Joining me today is a great panel. Dr. Kim Blackwell, who's a professor of medicine at Duke Cancer Institute and head of the breast cancer program there. Dr. Richard Finn, who's associate professor of medicine at the Geffen School of Medicine at UCLA in the Division of Hematology Oncology. Dr. Ruth O'Regan, who's professor and vice chair for educational affairs for the Department of Hematology and Medical Oncology at Emory University. And Dr. Lee Schwartzberg, who's professor of medicine and chief of the Division of Hematology Oncology at the University of Tennessee Health Science Center and medical director of the West Cancer Clinic. Thank you to each of you for joining us today, and now let's get started. So, research investigating biomarkers for early detection, prognosis, and prediction of treatment response in breast cancer is rapidly expanding. However, in routine clinical practice, breast cancer detection and management remains dependent on invasive procedures, and diagnosis based on the tumor histology remains the norm. There are, however, immunohistochemical and genetic tests that are often useful to support treatment decisions and determine prognosis. So the real question here, I think for all of us to kind of get started, is we all have been doing this long enough, I think. Most of us here are fairly experienced medical oncologists. And we remember the day before all of these genomically driven tests. And by genomically driven tests, I think the things we're kind of talking about are Oncotype DX, the 21-gene assay, MammaPrint, the 70-gene assay. Some of us actually have been involved in the development of the BCI assays, the Biotheranostics assay, and now the Prosigna nanostring. And so the question is, I think let's get started just by kind of talking about it. I think that, how has it changed, Lee? Let's start with you. How has it changed your practice? I mean, things like Oncotype.
I think, Adam, this has been one of the most profound changes we've seen over the last 10 years. The understanding that we go beyond H&E, a technology that dates back to the 19th century that we still use to diagnose breast cancer, and that we still use to make decisions based on the anatomy of breast cancer, the size of the tumor and the lymph nodes. We're now moving to looking at the biology. And what these genomic expression tests do is look at the biology of cancer, and they basically reference different gene sets which give us some information about the prognosis of estrogen receptor positive breast cancer predominantly in the face of endocrine therapy, and then also give us predictive value, at least validated for the Oncotype test, for whether or not there's benefit from chemotherapy as well. So what we've seen over the last 10 years is a paradigm shift from virtually all women who had a certain size tumor, let's say 1 centimeter or greater, getting chemotherapy, which was actually recommended by the NCI some time ago, to now less women getting chemotherapy because their biology suggests that they will not benefit for it. And so understanding these different subtypes of breast cancer has made a profound change in the way we think about breast cancer.